Since most of you guys have probably already heard, this is this is Tiffany. She's a pediatric oncology RN, and today she will be presenting a case study, but she will also be talking about her background a little bit and her story and journey of how she got here. And it's super unique. You guys are going to love it. I promise. Super inspirational. If you guys have any questions along the way, just make sure you guys leave them in the chat, and I'll go through those while we're going through, and we can answer some of those at the end or like in between, depending on how we go. But I'll let you introduce yourself now.
Okay, by the way, guys, Karen and I have been talking for like 4 months trying to get this scheduled. And finally, after 4 months, you guys are having this. So
I know it. Honestly, it's like I'm a dream. I'm in a dream.
okay, so I'm going to share my screen. My name is Tiffany. I'm a pediatric oncology nurse. Like she said, I'm also a part-time MBA-HCA student and Hello Tiffany RN on Instagram. So I'm going to go ahead and share my screen. Let's see which one.
While she's doing that, I'll post her Instagram link in the comments so you guys can go check that out as well. Sorry, continue.
Okay, it's okay. So hopefully this PowerPoint is not boring. I don't really like looking at black and white PowerPoints because they bore me. So hopefully you guys can stay awake. Okay, so just a little bit about me. Can you see you or are you blocked?
I can see me.
Oh.
You're fine. I mean, I can see the whole, it's going good. You can see it on YouTube too.
All right, so just a little bit about me. I'm 23 years old. I was born and raised in Houston, Texas. I have 2 older sisters. I'm the youngest of 3. The middle sister is a 4th-year DO student. She's about to graduate, so that's exciting. And then my oldest is a chiropractor. I'm a pediatric oncology nurse. Like I said, if you don't know what that is, pediatric means kids and oncology means cancer. So I care for kids with cancer. And this is a fairly new job. I just started in September? Yeah, so pretty new. I'm also an MBA-HCA student, MBA meaning Masters of Business and Administration, and HCA is with a concentration of healthcare administration. A lot of people ask me like, why go from nursing to business? And there's many, many different options after nursing school to advance your degree. People always think it's either NP or CRNA, and those are the only 2 options. But if you really do your research, there's so many different ways that you can advance your degree. So for me, I want to be in the leadership side of the hospital. I want to manage people. I want to be like in a chair or a division. And a lot of that comes with experience. So usually those people with those positions, they've worked at the hospital for many, many years. But what will leverage me is having my MBA, because my MBA teaches me how to communicate effectively with people, the health policies, the politics of the hospital and things like that. So it'll definitely leverage me against the other candidates. I'm also a virtual nursing mentor, as you guys know, Hello Tiffany RN. And if you weren't there for it, I got this name because I really liked Hello Kitty when I was younger. And my name is Tiffany. So my sister was like, let's just do Hello Tiffy. So that's how that came about. Wait, there you go. So I'm just going to talk about a day in the life of a PD oncology nurse. So this is typically how my schedule works. I'm a full-time nurse. This is going to be inpatient, which means I care for the patients inside the hospital, versus outpatient are people that go to the clinic for like appointments and stuff. So full-time as a nurse, inpatient nurse is 3 days a week. Each shift is going to be 12 hours, more or less. Let's say that you have extra charting to do, then you have to stay, longer than the 12 hours. So for my unit, we typically get 3 to 4 patients per nurse, but because of the pandemic, the census has been down. So the last 2 shifts, I only had 1 patient, but she was a more critical patient. But for the most part, it's 3 to 4 patients per nurse. Our population is kids and young adults. And we see a lot of leukemias, stem cell transplants, osteosarcomas, rotation plasty, methotrexate clearance. I'm not going to go through the depths of that because I know that a lot of these that are watching are nursing students or like pre-health students. So I don't want to like overwhelm you guys with information because I'm pretty sure you guys just came off of school or something like that. So what we usually what we usually do like on a daily basis is pain management. A lot of these cancer kids, they're in constant pain. Administering chemo, blood and platelet transfusions, lab work. So what lab work is we draw blood, and then in the morning we'll look at the labs and see, so what are the electrolyte levels, what's the hemoglobin level, and then we'll do any replacements if needed. Count recovery, what that is chemo wipes out all of the cancer cells plus all of the other cells too. So it's non-discriminatory. So all your white blood cells will be gone, all your red blood cells, your platelets will be gone. So your whole immune system is wiped out. So that's why you're more prone to infection. So what we want to see is your neutrophil count, which is what helps you fight infection. We want to see that ANC rise. So that's what count recovery is. Also, nausea control. A lot of these cancer patients, one of the biggest side effects of chemo is nausea. So we do that. TPN, the best way I can describe TPN is like food in a bag that is given through the IV, because a lot of these cancer kids, they have mucositis, which is really bad inflammation, really bad lesions and sores in the mouth. So they don't really eat a lot and their nutritional intake is pretty poor. So we have to give them something called TPN, which includes all of the nutrition that they need, and that goes through either a PICC line or a portacath or an IV. CBI is continuous bladder irrigation. One of the biggest side effects of chemo can be BK virus, which can cause hemorrhagic cystitis, which is inflammation of the bladder. So their urine is just going to be straight red because it's just so bloody. So we have to irrigate the Foley, which is it's like a tube that we put through the urethra, and all their urine drains into a bag. So we have to have these big 3000 ml NS bags, and we hang them on the IV pole, and it's connected to their Foley, and we drip them by gravity, and it'll flow through the Foley so that we can make sure that there's no clots and the urine passes well, and we want to see a pink color. And also managing fevers. Like I said, chemo wipes out every type of cell, so their immune system is going to be low, which can cause infection, and fever is one of those signs and symptoms of infection. So I want to go ahead and talk about my nursing journey. I know there's a lot of pre-nursing students out here, or even high schoolers that want to know how you can get into nursing school. So after I graduated high school, I looked up all the nursing schools that I wanted to go to online, and I looked at their admission criteria and all their prerequisite classes. For the most part, the prerequisite classes are pretty much the same all across, but there may be like one or two that are different. So what I did was I went to the University of Houston and community college because it was easier to sign up for my classes there. And I would just complete those prerequisites. A lot of people ask me, so what major did you major in when you went to college? And I'm like, I didn't major in anything. But on paper, I just put, I don't even remember what I put on paper because the college wanted, I think I put like biology or something, but I never completed, like, I never followed that biology track. I just did what I knew I had to do. And there are many different ways to become a nurse. You can get your LVN, or you can get your bachelor's, but traditionally a lot of people just go for their bachelor's of science in nursing. You don't need a previous bachelor's to go to nursing school. People do get a previous bachelor's just so that it looks better on their application. But I think, in my opinion, the fastest route is to just go straight to nursing school. And if you get a previous bachelor's, that's even more money and more time. So after I completed those prerequisites for nursing school, I took the HESI and the TEAS test, which are entrance exams to nursing school. Some schools require different ones. I just took both. And I did that, I passed that, and then I applied to nursing school. And in September 2017, I started an accelerated Bachelor of Science in Nursing program at the University of Texas in Medical Branch in Galveston, Texas. And it was 16 months. It was really fast paced and probably the hardest 16 months of my life, but it was so worth it. And then in December of 2018, I graduated. And I decided to take like a week off after I graduated just to relax. And then I was studying for the NCLEX, which is the licensing exam to get your license as an RN. So when you graduate, you'll get your BSN, but you aren't actually an RN until you take that NCLEX and pass. And then starting February 2019, I started my first nursing job. And this was on an inpatient post-op GI, plastics, and oral surgery floor. So we got a lot of colostomies, eyelid surgeries, breast augmentation surgeries, and jaw surgeries. And then when you're applying for your first nursing job, you will be applying to residencies. And you're probably like, what is even a residency? Like, I thought that was only for like doctors. So a residency for nurses, most major hospitals will require new grads to go through a new grad residency. So not only are you working those 3 shifts a week, but you're also going to classes with other new grads in your cohort that you started with. And these classes can include things such as skills that you'll do on the unit, any education, learning how to document, and it's good because you get to be with other people who are going through the same thing as you are. Starting off as a new fresh nurse right off of nursing school is definitely not easy, but it's so comforting to know that other people are going through the same thing and you can talk to them about it. So that residency is typically a whole year. And at the end, you'll do an evidence-based practice project, and then that's pretty much it. So in March 2020, that's when I completed my nursing residency.
So, I see a few questions, just about your education. Are there any specific nursing schools that you would recommend? How do you get into a residency of your choice? And any advice for advanced nursing programs, like for people trying to apply? I know those
So
are a lot.
yeah. So I really can't speak for any other nursing school except for mine, which is UTMB. UTMB has a 99% NCLEX pass rate. And whenever you're searching for nursing schools to go to, I definitely recommend Googling their NCLEX pass rate, because you could talk to other people and they could say, oh, this nursing school was so easy. But what is their NCLEX pass rate? Is only 60% of the class graduating and passing their NCLEX? Well, then that's not a good school to go to.
Mhm.
And then the next question was
Um,
short-term
how do
memory.
you get into the residency of your choice?
So how you get into the residency is in your last semester of nursing school. You will actually, in the break between your second to last and your last semester of nursing school, you'll be preparing for your applications. So that includes your resume, your cover letter, your portfolio, LinkedIn, what else? Asking for letters of recommendation. So you'll have all that ready. And so by the time that that last semester begins, you can start applying to nursing school. Start applying to residencies. And you can learn more about them just by Googling up the hospitals in your area and seeing if they have residencies going on. There's a whole pandemic right now. So I said that as if nobody knows. Why did I say that? I don't know.
No one here knows,
Yeah,
just
no one
us.
knows COVID, but us. But some of the residencies are on hold right now. But I'll talk about more about that later. And then the other question was how to advance your degree. Is that what it was?
It was just advice for getting into advanced nursing because, like, to my understanding, it can be competitive to get into a program like that.
Okay, so how to get into nursing
The
school.
accelerated
Oh, and the
nursing, yeah.
accelerated.
Yeah.
Definitely do like what you're on right now, like virtually shadowing, virtually volunteering, doing free certifications. There's a couple on my website that you can do from Ivy League schools that are absolutely free that can definitely boost your application.
And just my own plug. If you guys need volunteering hours, we do offer a volunteering program. So,
Oh, yes, you just started that too. It's new. I
yeah.
Okay. So I talked about my role as a PD oncology nurse, but I'm also have most of my experience from nursing comes from med surg, and I feel like a lot of nursing students, when they graduate, they decide to go med surg route. So I want to talk a little bit about what med surg is. So what we do is there's a lot of skills as a med surg nurse that we do. So monitor the patient status after surgery. We do wound care, drawing labs, that's supposed to say administering meds. educating patients. So my med-surg floor was an adult floor. So not only are you caring for them just within the surgery aspect, but they also have other diseases going on outside, such as like blood pressure issues or diabetes. So you also have to keep in mind that you're not only caring for the surgery part, but also what they came in with before. So diabetes management, Foley, NG tubes, TPN. So just a bunch of skills as a med-surg nurse. But I feel like I stayed on this floor for 14 months. Let's see, I graduated my nursing residency in March of 2020. So yeah, that was like at the 13th month mark. But I really feel like I got a really good nursing foundation coming from a med-surg floor. And then from there, now that I am a PD oncology nurse, it was a smooth transition for me. When you start, it's going to be hard, but you'll learn as you go along and it gets easier. So like I said, I was on here for about 14 months. March of 2020 was when I completed my residency. And this was during the time when COVID started to happen, right? So there was a lot of changes on my unit. And a lot of people are thinking like, oh, there's such a nursing shortage because that's what they see on the news. So what happened is that I worked on a surgery floor. During the start of COVID-19, when there was changes in the hospital, they decided to cease all elective surgeries in the hospitals. That meant the majority of the population on my floor was gone. So we typically had 28 to 30 patients on the floor. And whenever this happened, whenever the surgeries got canceled, we probably had about 6 patients on the floor. And if there's about 5 patients per nurse, 4 patients per nurse, well, guess what? You only need 3 nurses a shift, right? And so the other 4, what are the other 4 doing? Well, they're being called off. So when you're called off, you don't get paid. You can use PTO, you can get paid, but if you don't use PTO, you're not being paid. So everybody was fighting to work, but there were no patients to work for. There was no patients to take care of. So this happened hospital wide. You know, it wasn't just my floor that was low patient census. You could float, which means that you're not going to be working for your floor, but you're going to work for another floor that needs help. But because the entire hospital was low patient census, they couldn't accommodate everyone to be in this float pool. So really you had no choice but to be called off and use PTO if you wanted to get paid. I was um I was lucky enough, I don't have kids, I don't have a house to pay off, so I was stable enough to not take the PTO and not get paid, but there are other people who are fighting to work because they need this money, right? So what ended up happening was we actually combined floors with another floor that also had low patient census, and so our nurses and their nurses were trying to get scheduled for that night. But again, if there's no patients, who are we taking care of, right? So I
Right.
think the last couple of weeks that I worked, I probably worked 1 day out of the 7 days of the week just because there was nobody to take care of. Um, and so that time off, it really got me thinking, you know, what do I want to do? What's my next move? And I know that there's a lot of people who their destiny is to be a bedside nurse their entire life, and that's fine. But for me, I know that I want to do something um, more than where I was at then. So it got me thinking, and I was thinking about my goals and what I wanted to do in the future. And if you are on social media during quarantine, or like if you're on TikTok and like the health side, you saw a couple of nurses and like healthcare professionals, they actually quit their job because it was so emotionally draining for them, or for whatever reason, that they had to quit their job during COVID, just because it was really taxing on them. And maybe for other people, it would be different reasons, but if you look at the comments, there were so many people bashing them, like even healthcare professionals themselves bashing them, or people saying, you know, you left them when they needed you the most, or you're scared, you shouldn't work in the healthcare field. Well, I was one of them. I posted a TikTok that went viral, and I basically said that I quit my job during COVID. So I quit during April of 2020. And in that TikTok, there were a lot of people that were calling me a clown. They were saying that I shouldn't be a nurse. I wouldn't want my kid's nurse to be you. How could you do that? And things like that. I knew myself. I didn't say why I left, but people just assumed that I was taking care of COVID patients and that's why I left. But really, there was no patients to take care of, which they didn't know. And I didn't feel like explaining myself. Um,
Right. And that's kind of like where the toxic side of like social media comes in. Like, I don't think we realize it, but like some of these comments from people who know nothing about like people's backgrounds and their stories just make the like rudest comments or like death threats. I know it's gotten that far with like death threats a lot of the times. And it's just something we have to watch for. There's like perks of social media, but
yeah.
I feel
But
like that's like growing.
that's one of the risks that you do when you put your story out there. When you put yourself out there,
Mm-hmm.
you should expect that. But it didn't bother me because I knew that nobody, I could be a cosmetic nurse for all they knew, and they were bashing me for quitting my job during COVID. Um,
Mm-hmm.
so I decided to quit. I didn't have a backup plan. It was kind of like a on the moment kind of thing. And I loved the people I worked with. I loved my manager, my coworkers. We all worked as a team. We were like family. I worked night shift. So I feel like night shift, the nurses are closer than day shift, but that's another story. But I've loved where I worked, and it wasn't anything about the institution or anything. But during quarantine, I um, really felt like this was a time to do a lot of professional development for myself. If I'm not doing anything, I don't want to just sit around doing nothing, right?
Mm-hmm.
So why did I quit? A lot of people are going to ask me. There's several reasons why I quit. My goal starting off in nursing school was to always do pediatrics. That's what I always wanted to do. The institution I was at was it was entirely adults. So there was no way I could even switch floors if I wanted to because pediatrics was not an option there. I felt like I had gained enough of my med surg foundation and built a strong foundation as a new nurse that I could go and pursue a more specialized population like pediatrics. If you go to clinicals, you will see that there may be one or two nurses that have been on that floor for 30, 40 years. And maybe they just really love the floor that much. But a lot of the times, more than not, people get complacent where they're at. It doesn't even have to be nursing, it could be any job. When you first start out, it's going to be super hard, whatever you're doing, right?
Mm-hmm.
It takes time to learn all the things, to learn who to talk to, learn where your resources are. And for me, it took a good 6 months to finally feel comfortable going to work and knowing that I know what to do and knowing what to expect. And so it's really scary thinking that if you move out of that comfort zone, you're going to have to do it all over again. And that's why you see a lot of nurses that are on the floor that have been there for 40 plus years because that's all they know and they don't want to learn anything different. Not saying that's the case for everybody, but for a lot of people, that's what it is. So, I feel like I'm still a new nurse, so I'm going to call myself a new nurse. I feel like there's more out there than med surg for me. And I don't want to stay complacent and I don't want to stay in this little bubble and comfort zone because I want to achieve something greater. So that's why one of the reasons why I decided to leave. Also, safety. When the World Health Organization, CDC, when COVID first came out, they declared it as an airborne disease, meaning that this is a way of transmission of disease. So airborne is really, really tiny droplets that you can't even see with a human eye. Sometimes it comes out when you're talking or singing or coughing, and that requires an N95. And the mask that we wear, like on a daily basis, that is not enough to cover these airborne droplets because they are so small. After there was an N95 shortage, I wish I had the dates, but when you actually look at the websites, everything is up to date. You can't go back to see. But when there was an N95 shortage because they were declaring it as airborne, that's when they decided to call it a droplet precaution. And droplet only requires the mask that we wear on a daily basis, which doesn't cover those tiny, tiny droplets. Now, do I know what the size of the droplets are? No, I don't. But you can make your own assumption whether you think what can protect you from COVID is it an N95 or is it a mask? Because right after the shortage, that's when they declared it as a droplet. And now we know that it's an N95, so it's back to airborne. If you don't know, with these N95s, you actually have to be fit tested for them because everybody's face is different. There's different sizes of these N95s. Mostly it comes from your nose bridge. So if you have a flat nose bridge, you could have an air leak and then the N95 would be basically useless. I was never fit tested for an N95. I didn't even know what an N95 looked like. I've never held one in my hands before. I'd never even seen one in real life when I was at my old institution. They were only following the World Health Organization and the CDC guidelines, which was droplet precautions, which was a normal mask. So they were giving me the proper PPE based on the CDC and the World Health Organization, but myself, I felt more comfortable if I had an N95. And my whole family works in healthcare. So it would be like me going home and spreading it to everybody. I was actually fit tested at my new job and comes to find out I failed my fit test because my face did not fit any of those. So even if I did wear an N95, it wouldn't fit. So I have to wear like one of those big like respirator things that like, it looks like when you go to like a beehive and like the beekeeper wear like a big mask. That's what it looks like to me. So those are the main reasons why I left. And it was pretty tough because I was at home and on the news, all you would see is healthcare heroes being praised, nurses being frontline heroes. And I'm at home, like I just left my job. And there were so many nights where I felt like I shouldn't be in the profession that I'm in, that I turned my back on nursing, but in my heart, I knew that I didn't. So people would say things like, oh, you quit nursing when they needed you the most. And for this reason, like I knew people were going to say this, so I didn't say anything at all to anybody. Only my family knew, and my family was very supportive of me. Not even my Instagram followers knew about this because why would anyone want to take advice from a nurse when when they quit their job during COVID? So no one knew really. And I kept it all secret. I felt like I was like Hannah Montana, like living two lives.
But I mean, like, your reasons were more than valid. If you're not receiving like proper PPE, you're just risking getting yourself sick and spreading it to other people, even more patients and stuff like that. But obviously, it's not always like reasons you can tell the whole world. So I think discretion was, yeah.
Right. But I felt like it was more appropriate to share my story once I got another job because it would show people that I wasn't leaving nursing altogether. And that's why I kept it in for so long. So y'all are probably asking, well, if you didn't have a job, like what did you do during quarantine? People are probably gonna ask. So no, I didn't just stay at home and do nothing. During this time, like I said, surgeries were canceled. Surgeries are one of the biggest sources of revenues for these hospitals. Now, if the surgeries are canceled, the hospital's not getting the expected revenue that they want. And if they're spending all their money on this PPE, well, where's the money going to come from if they have to hire new nurses? So yes, I was applying to different places. The night after I sent in my resignation letter, I was applying for places, but obviously these hospitals don't have money to be hiring anybody right now. And that's why there was a nationwide hiring freeze, even for nurses. I know a lot of people are going to be like, well, on the news, it said there was a nursing shortage. Well, how are they going to accommodate to hire these nurses if they don't have money? So it's really hard to get a job. And that's why I was employed for so long, for 4 months to be exact. So what did I do during quarantine? So because of this hiring freeze, I knew I had to do a lot to amp up my resume. I had to work up my portfolio. I had to generate the best cover letter that I could. So I completed 12 certifications, and these certifications a lot of them come from Ivy League schools. During quarantine, Johns Hopkins University and other Ivy League schools, they provided free certification courses that you can take to further your professional development. So I took those. One of them was a COVID-19 contact tracing. So I did that. I also started to mentor nursing students around the world. And like I said, I kept it a secret that I was unemployed and I quit my job because who would listen to me when I wasn't even working as a nurse? I started my nursing Instagram at Hello Tiffy RN, and just yesterday I hit 20,000 followers. So that's really exciting. I
We
know
love that.
that's super exciting. And I also began my own website because if you guys follow me on Instagram, I share so many resources. It was getting like out of hand trying to send people links. So I decided to just create my own website and put all the links on there. And that is generating more than 10,000 views per month, which is amazing. And I'm pretty sure everyone downloaded TikTok during quarantine, and there was a lot of people on TikTok that were starting their own small business. So I was like, I want to do that too. So I co-founded a 3-time sellout small business with my sister. I also started an MBA-HCA school at Texas A&M University in Corpus Christi, and also created my own activity book being used by pediatric patients across the US and 4 international hospitals. So I knew that all these things, I wasn't just doing it for myself, but I knew I could put this all in my resume to make me stand out against other people. I did a lot of research on how to stand out because there was a hiring freeze. So I wanted to make sure that my application was top notch. So I applied to 22 jobs and rejected by 14. I was even starting to email places that didn't even have job listings to see if they would take me. Sometimes I would be up at 2 a.m. in the morning trying to find jobs on anywhere, any Google, what are those other sites? I don't even remember. But anywhere
Wait,
I could apply.
I'm thinking that one orange. It's got that orange logo, but now I can't remember what it is.
One of them is like open door. I don't remember.
Yeah, something. Dang, it's like at the tip of my tongue. Anyway, it's fine.
Okay. So I applied like almost every day. I have a running list. I have a notes app on my phone, and I was typing everywhere I was applying. I was rejected by 14. And finally, after 4 months, I finally got the job as a pediatric oncology nurse. And being a pediatric oncology nurse has been like one of the biggest blessings in my entire life. It is so rewarding. I feel so appreciated by my patients and my patients' family. And to think that you're caring for somebody in their most vulnerable state and helping them to fight their biggest battle of life is amazing. And I'm so grateful for it. And that's my friend Tyler. He doesn't work with me anymore, sadly. He's somewhere else, but he was an amazing coworker for that time being.
That's amazing. Like, honestly, it seems like a wonderful job, but I did see in the comments a question with how do you deal with the heartbreak and like keep up mental health when working in a profession like this one? Because obviously not all patients make it. So, how do you mentally cope with that?
Yeah, so I have been working here for not too long, so I haven't had to deal with any death yet, but it is definitely, there will be some patients where you know that they've been there for months, and because of the restrictions right now, they can't leave the hospital, they're immunocompromised, they might not have seen sun in 4 or 5, 6 months, haven't seen their friends, there's strict visitation policies right now because of COVID. So not only do you see yourself as a nurse just giving meds, you have to talk to your patients, talk to them as if they're a real person, ask them, what do you like to do before this, what kind of sports did you play. In my last 2 shifts, I had a patient, she had been in the hospital for about, I don't know, since September, and we watched movies all night long. We watched Frozen, we watched Trolls, And she was showing me videos of her before she was pre-cancer diagnosis. She had this long, beautiful brown hair. She was a softball player. She was on the varsity freshman team, and it made me tear up bad in the patient's room. And I don't think it's bad to cry in front of the patients because it shows that you care. And it shows them that you're not just a nurse. You'll be there for them through thick and thin. And so just talk to your patients and develop that rapport with them, develop trust with them, and they'll be wanting to talk to you more, not just, okay, here are your meds, take them, and then you leave.
Right.
Yeah. So like I said, I did a lot of research about job applications, and I wanted to share my knowledge because I know that it worked for me. So I'm like, why would I just keep it to myself? Because new grad nurses are I don't know if you guys know, they're one of the most expensive to hire because of their training process. So if it took me, an experienced nurse, 4 months to get a job, I can only imagine how hard it is for a new grad to get a job, right? So I started to do resume reviews, cover letter reviews, resumes, portfolio, crash courses, interview prep class. And almost every day I will get a message from a follower saying, oh, I got this job. I got my job at this dream hospital that I wanted. Thank you so much. I took your interview class and whatever. And it's the best feeling because I know where they're coming from. I was in the same position that they were. And even when I first started out my Instagram, I was helping people do resume reviews. Little did they know I was trying to amp up my resume myself to get a job just like they were, but they had no idea. So I decided to share my knowledge with other people and flip it around so that they can have the same success that I did, because there's so much success in the world. I feel like we should all share it.
Mm-hmm.
So the takeaway from this, this is me, pre-quarantine, don't worry. Make decisions for yourself, not what society expects of you. If I were to take what other people said, that I shouldn't have left my job, I would never have started my master's school, never would have started a small business, never would have started this website, this Instagram. You guys would never even know who I am. I would have never been in pediatrics, which was my goal. Last week, I was invited to speak for the California State University in Los Angeles. That would never have happened. I know.
Oh my God, congratulations. That's awesome.
Nobody knows. I just let that slip. But none of that would have happened if I would have stayed at the same job that I felt complacent at, that wasn't my goal. So do what you want to do because it's your life. Make your own decisions. Don't let anybody tell you anything else because you know the best for you despite what anyone else says.
That is the biggest takeaway, honestly. Like, that was so inspirational. Like,
so when you're doing your summaries, you can put that quote in.
Take a picture again.
Right. Okay, we'll do a case study. We'll actually do something educational. All right, so this is actually one of my patients that I had maybe like 7 months into being a nurse. It was a 32-year-old male. I was a med-surg nurse, so he had a wound closure surgery. It was successful. No complications after the surgery. I was a night shift nurse, so the plan was he was going to have dialysis in the evening and then plan to be discharged the next morning. Sounds good, right? So the patient came back from dialysis around 9 p.m. And if you know anything about dialysis, it's really expected for these patients to be sleepy just because you're taking off so much fluid from them. So they're expected to be sleepy and low blood pressure. That's expected. So I wouldn't call the doctor for that. So he's A&O times 4, meaning he was alert and oriented. He was sleepy, but he answered questions appropriately, like, what's your name? Where are we at? What's your date of birth? No complaint of pain, IV intact, everything looks fine. Dialysis catheter was wrapped. There was no concerns, and the patient said he's excited and ready to go home tomorrow morning. So we took his vitals at 9 p.m. Blood pressure 100/76, which is on the low side for a 32-year-old male, but he came back from dialysis, so that's expected. Heart rate 115, temperature 98.6, respiration 16. So everything looks pretty much good except for that blood pressure. An hour later, I took the blood pressure again, 95/70. So it's going down. Heart rate going up a little bit, 118. Temperature is fine, respiration's fine. He's drowsy. Well, now he cannot carry on a full sentence or conversation. Well, it's 10 p.m. It's getting kind of late. He probably had a long day, right? His eyes were closed. He's in deep sleep. Just to be on the safe side, here are my interventions. This is what I did. I communicating my findings with the charge nurse just to make her aware if anything happens, right? I also wanted to notify the resident just in case anything happens. You always want to cover your butt. Think about if this was a legal case, what would make you cover your butt? Always, right? So the resident said, "Thank you for your concern. Our team has already signed him off," meaning that they're going to be discharging him tomorrow morning. So there's not really much she can do. And there's no harm in, calling a doctor and just letting them be aware of things. So I documented my assessment and continued to monitor the patient. And this is the same vitals at 10 p.m. It's just saying low blood pressure, high heart rate. All right, 11 p.m. Let's look at the vitals. Well, the blood pressure is going even lower, 93/67. Heart rate getting higher, 123. Temperature almost close to a fever. Respirations are the same. But look at here in the assessment, he's having mental status change. Whenever you see mental status change, they're talking gibberish, they're super drowsy. It's time to call the doctor because something weird is going on. So I called the attending, no response. I called the NP. Whenever there's no response from the attending, you keep going up higher until you get some answers. I called the NP to assess them at bedside. I said, "Hey, this patient is having some mental status change. I need an advanced provider to come to the bedside now and assess him." He came to the bedside and just told me on quotes, "Continue to monitor." Everything that you call, everybody you call, every response you get, you have to document this, because if I did not document this, I would be in big trouble because something is happening, but nobody is listening, right? So I have to make it known that I'm calling these advanced providers and they're not doing anything. I called infectious disease because he did get a wound closure surgery, and one of the biggest complications after surgery is infection. So I decided to call them. I drew blood cultures, which blood cultures basically tell you if there is an infection, what kind of antibiotics or what kind of antibiotics work against it, but these blood cultures won't come back really fast, right? So I drew them, but we can't do anything with them right now. I called the attending again, no answer. Like I said, you have to document all your calls and provider responses, continue to monitor them and communicate them to the manager. So what do you do if you're in this situation, right? I called the attending, no response. Call the NP, nobody is listening to me. Call the infectious disease, call the resident. So what did I do? Okay, well, that's not on that slide yet. Anyway, a common complication after surgery is infection. Like I said, he came in for wound closure surgery, and also he has a PICC line. And what a PICC line is, it's in easy terms, an IV that goes all the way to your heart. And your heart pumps blood all throughout your body, right? So what eclampsia is, it's a central line associated bloodstream infection. If that PICC line is infected, that's connected to your heart, and that blood is going everywhere in your body. So now the infection is all throughout your body, right? And that's called sepsis. And this is a threatening emergency when an infection spreads to the bloodstream. So it could start from the PICC line, and then go everywhere else. I didn't have him, I was off the next couple nights, so I don't know where the source of infection came from. But here are some of the signs, symptoms of sepsis. Low blood pressure, which he had. I thought it was just from dialysis, but it kept going lower. A high heart rate of 123. This is your heart compensating for that low blood pressure. If you have low blood pressure, your heart's going to pump even faster to try and get that blood to the rest of your body. Fever and tachypnea. Tachypnea is breathing faster. So what did I do? Nobody was listening to me. I called all the advanced providers, called the attending, no response. I called a code blue. What did I do during the code blue? What orders did they put in? So a code blue is an emergent situation in the hospital, and they have a designated advanced provider, a team of advanced providers that come to the bedside when you have a code blue, and they might not be the people that are caring for this exact patient. So you have to give them a full report of what's going on with the patient because they don't know who it is. So we gave a fluid bolus. A bolus is a big bag of fluids. And what we do with this is the blood pressure was low. So if we give them a push of fluid, it's going to raise their blood pressure. a rainbow of labs. So if you have gotten your labs, if you had gotten your blood drawn before, you see that they put it in a little tube. Well, in the hospital, there's a bunch of different color tops of tubes. So we want a rainbow of labs because we want to know everything of what's going on. Blood cultures, which is already done. We want to start antibiotics because he does have an infection, start Tylenol to manage that fever, monitor his input and output, which is how much did he drink and how much did he pee, and keep reassessing the mental status, and monitor those blood levels. What we're trying to do is we're trying to prevent MODS. And like I said, if you have low blood pressure, high heart rate, if you have sepsis, your organs are not getting enough blood, and your organs are supplied by your blood. They only work if you have blood going to them. So if you don't have any blood going to them, they're going to fail one after the other after the other. MODS is multiple organ dysfunction syndrome, and this is when 2 or more organs start to fail. It's kind of like tumbleweed, one after the other, they're going to start failing, and that's what we're trying to prevent. So that's about it with the case study. And this is my contact information. I don't know if you want to do questions now or because we have a little bit of time left.
Yeah. So someone asked, in sepsis, what is typically the first organ to fail?
It depends really where the source of infection is, but it will differ for every patient.
Mm-hmm. So in a situation like this, you get the code blue team in. Do you know what types of steps they do to help him recover? Like a full-on emergency, like what do we do?
So usually with code blue, they will put in the orders themselves. You just carry them out as the nurse, but it's pretty much expected. You're going to have to draw labs most definitely because they want to know what's going on. You will most likely be drawing blood cultures to see if there's a source of infection. You need to start antibiotics right away. They will start a broad spectrum antibiotic, which kind of covers everything, but that blood cultures really tell you the specific antibiotic that will target that infection. You most likely will do a fluid bolus if they have low blood pressure. What are some other common code blue? Oxygen, if your blood carries oxygen throughout your body. So if he was having irregular respirations, we might have RT put him on oxygen, do a treatment or something. But really, it's all based on what the providers want you to do with them.
Someone asked, was there a happy ending for the patient? Do you know?
I know he was transferred to the ICU. He was a very pleasant patient. But after he got transferred to the ICU, I don't know what happened. I wish I did. Because when you're in the hospital, you can't look up other patients outside your department or else you'll get flagged for looking at other, patient sensitive information.
Mm-hmm. Right. That would, because of HIPAA and stuff like that. Some people are asking about the certificates. Were the certificates free? And will this give me points in my nursing application? So we want to talk a little bit more about like the services you offer and stuff like that, I feel like.
Yeah. So if you guys know me, if you follow me on my Instagram, you know I'm all about the free stuff. I will not share something if I feel like it's too expensive, but mostly everything I share is completely free, which all the certifications I did was free. So I did a couple from Ivy League schools. They're all on my website. If you go to hellotiffnyrn.com and on the side, it'll say free certification. Just click on it. There are some that have expired. So I got a couple from Texas A&M University, but that deal is no longer there anymore. I got some from Houston Community College, which some are not there anymore. But LinkedIn Learning has a lot of good courses that you can take on there, and you can do a free trial. So I think I did maybe 3 certifications a day, and that free trial was for a whole month. So you can do that from LinkedIn Learning. And then I think that the Johns Hopkins one is still there. They came out with a second COVID-19 one, which you can both do. And this will definitely help you gain extra points on your resume and your nursing school applications, just because during quarantine they want to see, well, what did you do during quarantine? They want to see that you took advantage of your time and you didn't just sit around doing nothing.
Right. And that also applies to pre-med, because I saw someone asking about if this would be beneficial for pre-med? And I would probably say yeah, because honestly, anything that you do over quarantine that's showing like initiative and that you're trying and you're learning, I feel like that can't be detrimental. So
Yeah. My sister, she's a fourth year DO student. She's applying for residencies right now. She even did the John Hopkins COVID-19 contact tracing and put it on her resume. So definitely think it's, I feel like everyone should be educated on COVID-19 because it affects everybody.
right. I agree. Um, and just a few more before we like wrap it up. Someone asked, what advice, like one or two things, would you give per semester for students going into nursing school? Oh wow, that's
Uh,
a lot.
like first semester or per semester?
It's saying per semester, but if you want to go by like years, like this is what you should focus on the first year, just so it's like not as much.
Yeah. So every nursing school actually is going to be different in their curriculum, what you'll take in first versus second and third, fourth semester. So I don't want to go by semester, but I will say one of the biggest challenges that nursing school students go through is adult or med surg, whatever your school calls it. This is testing your nursing critical thinking, and it's hard because you're not a nurse yet. So how do you critically think as a nurse when you're not there yet? So definitely use practice questions. This is the way to go because nursing school tests are like no other tests that you've seen before. So doing practice questions on the daily will help you train your brain to think like a nurse. There's free practice questions on nurselabs.com. There's a bunch of free resources on my website. If you go, there's a new option on Instagram called guides. That's kind of like a PowerPoint for Instagram. I don't know if you guys have seen it yet, but if you go to my Instagram and go to my guides, there are guides for different classes. So if you go to MedSurg, there's a bunch of links there that you can click on that has practice questions that you can do. If you have any other like questions, my other guides can guide you through each class.
Someone said, on a personal level, how did you manage to function when no one was responding? Because I can imagine that was incredibly frustrating. Yeah, I probably would have lost it. I would have been like,
I just when you're a nurse, you have to advocate for your patient. So I will go as far as the earth just to make sure that my patient gets the care that they need. Obviously, nurses aren't able to put in orders themselves. So I'm going to keep going up the chain until I get an answer, and I'm going to be persistent and determined because if they're going to send this patient home tomorrow morning with an infection, that's going to be on me. They're going to look at my documentation. When I'm in court standing there, they're going to look at my documentation. Well, you didn't do anything. I mean, if the attending wasn't responding, why didn't you call anybody else, you know? And plus, you have to be an advocate for your patient. So I was just determined. I wasn't even like thinking, like, I wasn't even frustrated. I was just calling anyone I could.
right. More of like a, hey, this guy needs help more than like, why isn't anyone listening to me type of deal.
Right. Because you're just wasting time at that point.
Mm-hmm. So I see a lot of questions on how to get these shadowing hours in and like how to obtain a certificate. So if you guys like go to our Instagram bio, there's guidelines on how to get a certificate for shadowing hours. You just have to submit a summary to clubmedshoe@gmail.com. And once your summary gets verified, we will send over a certificate that says that it verifies your participation. I know that a lot of hospitals aren't letting you guys get in-person shadowing. So like if you guys can and are able to, I would recommend it. I'm not sure if right now would be the best time, especially with the incline of cases. I would recommend that you guys keep doing virtual shadowing for now, but when you do get the opportunity, do make sure that you do in-person shadowing because at the end of the day, that is that patient experience, like seeing how they interact with patients is important as well. And if you guys had any questions that we couldn't get to, because unfortunately it has been almost an hour, make sure you guys check out her website, follow her on Instagram. Let's get her to 30K. And
Whoa, that seems far.
look, email her if you guys have any questions. And Thank you so much, Tiffy. Like,
Thank
Tiffy, we appreciate you.
Me too. We had just talked about this. I said that people DM me saying hi, Tiffy, but my name is actually Tiffany. I'll respond to either or.
Mm-hmm. Thanks so much, Tiff. We appreciate you.
That too.
Mm-hmm.
But thank you so much. I know a lot of you guys were waiting for this for so long, but I hope that you guys enjoyed it. Thank you for being here on a Monday night when you probably have other better things to do. But yeah, thank you so much for having me.
Thank you so much. And if you guys have any questions that we didn't answer regarding summaries or certificates, just DM us. We're really fast on DMs, and we can get back to you as soon as possible. And we will see you guys all next week. Have a good week.